as you can see, this episode is not starting like normal, or maybe it is, but we just want to let you know that for the episode you're about to watch or listen to, we did have some audio technical difficulties, but I hope that doesn't stop you from enjoying this episode with our guest.
Jazzy from the Dawn team.
Yeah, so enjoy this episode and take care and stay safe.
Hi everyone, we're going to the Echo Pod. I'm Quincel and I'm part of the Echo team. And to my right we have...
I'm Jazz Rotor. You can call me Jazzy. I'm glad to be back, you guys. Welcome back. I'm a community health equity specialist with the Dawn program at Little Manila Rising.
Awesome. And to my left we have...
Hi everyone, my name is Dr. Freddie Riri. I am a critical care pharmacist. I focus on working in units in critical care such as medical surgical, COVID, neurotrauma, and those sorts of environments. And I also have a YouTube channel where I talk about health literacy and education. Traumacist RX. You can follow me there, like and subscribe.
Thank you both for coming back to have another wonderful conversation.
Happy to be back. This is awesome.
So today's episode, we'll be talking about social determinants of health in relation to COVID and asthma.
Well, this should be a really interesting one because I think that both Quincel and Jazz have a bunch of experience, and I mean, I have experience from a hospital perspective, but like, let's hear it. Like, what are the different types of social determinants for someone like myself or others who don't really know like what it is?
Yeah, so for social determinants of health, we have like social and community context, education, neighborhood and environmental factors, healthcare, and economic stability.
Yeah, I think literally every single one of us touch the lives of every human being, right?
Yeah,
I think that's the whole thing of like these are the social determinants. Like we have individual determinants, right? Of our age or our height, our weight, or all of that stuff. But like when we bring it into a social context, like looking at the culture, the community that we live in, all of these things contribute to health, right? And so, yeah, the folks that I go in to their homes and talk to them, like it's really interesting to see their relationship to how far it is for them to get like healthy food. How are they getting to their doctor's visits? How far are their doctor's visits? Like, are they spending time outside at parks or walking or anything like that, you know?
And let me just backtrack the definition of social determinants of health according to the CDC. It is but not medical factors that influence health outcomes. They're conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. So all the examples we just gave, that factors into your overall well-being and health.
I think the interesting is that these are the non-health factors, but at the same time are super important for health.
Yes.
And not just like, I mean, this is like super important for mental health, for like physical, for like longevity, like your life expectancy, all of that, right? Takes part. Yeah.
Yeah, so one of the ones that we want to talk about and address today is air quality in relation to zip codes and health inequity.
Yeah, I could speak to that. I'm actually a part of a subcommittee for indoor air quality on the AB 617. It's an assembly bill that was passed and that requires CARB and our air resource boards to, implement stricter and maintain stricter like rules around air quality and industry and truck pollution, and now indoor air quality is being looked at, which I think is so important.
Yeah, that's
what is allowing people's HVAC filters and things like that, and maintaining a certain level of maintenance in the home and outside of the home. Obviously, we're here in Stockton, California, and we're a port city, and so we're inland we're like in the valley, but we have like ocean going vessels. So we have this port here that's constantly releasing emissions and things like that.
Yeah.
And so that all contributes. And last year we were doing the Dawn program, and our youth advocates for Dawn were doing like a study and like looking at all the different research that has been gathered in this last year. And there's something like, I think 218 miles worth of truck routes in Stockton alone, just throughout the city.
That's crazy. And you're like, Stockton isn't like a major metropolis, but it's a decent sized city here in California.
Yeah.
And he said 218.
Don't quote me. It's an Instagram post though. We've no what's in that slide, but it's something like that. Yeah, it's like right news 3 hours.
I can think of every truck you see on the freeway just here in Stockton. Like that's a lot of miles, a lot of emissions, and it's around Stockton. Like this is around people who are like highly variable risk, high risk patients, those who don't even have a lot of resources, which we'll talk about. And I mean, like that's crazy, and that's just trucks.
That's just trucks. And if you like were to look at, so there's this fancy tool called like Cal Screen, and you can literally just Google that. Cal Screen, I think it's 4.0 is the newest version of it, and you can see these different either health outcomes and or like the contributions to unhealthy living in Stockton based on the area that you live in, the census tract. And if you were to look at like, have you guys all seen the redlining map for Stockton? Like,
Yes.
And for those that don't know, like redlining was a very obvious racist like laws that were in place. They kept people of color, people of lower socioeconomic status from buying homes like in healthy areas. And so on a redlining map, we'll see all these very red areas that are places where most people of color lived. And that's also where you'll see a lot of industry are. That's where you see a lot of the freeways are. And if you were to put that map and the Cal Screen map right on top of it, it's almost identical for like the amount of air pollutants, and the folks who get the brunt of that, the experience the most burden are those same folks, like historically, I'm saying like since the 50s and 60s, like still experiencing this health disparities.
That's very interesting. So, I mean, that's super unfortunate. And you talked about your team is working on how to fix it. So, like, what are some tangible things that our audience doesn't know is going on that is happening to help this population of people?
Well, one of them, I think you guys are definitely going to have to invite like someone from our EJ team to really talk about like the tree initiative that we're doing and plantings and Skywatch that we're doing, like attaching literal air monitors on people's homes so that they can have the knowledge like right there on their phone.
And that's super cool.
What does the air quality look like? And also the Dawn program. And I don't think I said last time I was on the show, but DAWN stands for Decreasing Asthma Within Neighborhoods. And it was named after our co-founder, Dr. Donna Ballin, who passed away due to an asthma attack. And she grew up right here in South Stockton, like near the freeway, experiencing the burden of the air pollution here. And so like one of the things we do at Dawn is go into people's homes, where they live, meet them where they're at, and educate them about like the different pollutants in their area, but also get their firsthand knowledge and experience, so that we can build that into advocacy. Like how can we like empower folks to speak up, or like how can we speak on their behalf, when it comes to sitting in these rooms with the Air Resource Board, like
Another state district as
us, and CARB, and how can we like have those voices be amplified and uplifted in those spaces that are actually experiencing this burden,
Is there something that our listeners can do right now, like, or is there any like techniques that you recommend or anything like that?
So do you mean as far as like what they can do in their home, or like around advocacy?
Both, if you have any ideas yet.
Yeah, I think one thing you can definitely do is visit the Little Manila website, like littlemanila.org, and there's the Skywatch program. You can also adopt a tree, which will later bring like better air quality in your area. Like, I don't know if you know, or if you've taken a trip in South Stockton compared to North Stockton, like the amount of trees is crazy, like we didn't, we just had all of that rain, and like, unfortunately, there was a bunch of trees that were like that are fallen over, but like here in South Stockton, there's not that many of them. And another thing you can do is sign up for the Dawn program, of course, but we have an advocacy day coming up, an asthma advocacy day, where we are going to be advocating for certain policies to be voted on by our legislators. And so we're going to be going to the Capitol in March 2023. So if you'd like to contribute to that, like, please go to our website. We're going to have the sign up list there. And we'd love to have your voices, be heard and tell your stories.
What is the website in case?
littlemanila.org.
Get littlemanila.org.
And there's a little Dawn.
Yes, and you'll see all the other programs that we offer.
Yeah, for sure.
Yeah, I mean, so going back to like the whole conversation about social determinants and asthma and all of that, like there's a lot of layers to social determinants. I mean, you gave the example of going to a person's house and how do they get their groceries, which has nothing to do with asthma and all that stuff, but it's something that affects their daily life. If they can't get their groceries or anything else, how are they supposed to pay for their medication? And how are they supposed to take care of themselves and get educated and all that time and effort and all that stuff?
Yeah, but your quality of life is decreased if you don't have food security.
Right. I mean, I would make the argument, though, too, that it does contribute to asthma. I think all of these things are intersectional.
Right.
Because it's like one trigger of asthma really that's overlooked, a lot of stress. You know, it's how stressed somebody is. Like
High cortisol.
right, like that absolutely, and anxiety, stress and anxiety like really trigger asthma attacks in a lot of folks. And so there's a huge like there's a correlation, and I know like correlation, causation, all of that is kind of up for debate, but most every person that I see has an interest in mental health services as well. And so like it makes me think about like how living with asthma affects mental health, how mental health affects asthma.
Like mindful breathing and then controlling your breathing affects your chronic disease.
And if you're focusing all of your attention on like, how can I get my groceries? How can I make it to work? How can I do all of these things? Like, you're not paying that much attention to your health, right?
What is the back burner?
Put out the back burner and it's to survive and on your budget. You're not going to use that extra effort or energy because you don't have any to seek your education. You're not able to ask the pharmacist, hey, can you teach me how to do this medication? And like, what do I need to look out for? And if you don't have those resources, or you're not able to have time to talk to your primary care recommend, if you even have one.
If I'll have one, do you know what the like street value of the albuterol inhaler is?
How what?
$70. Like, I know people who have bought from other people $70 inhalers because either they don't have health insurance or they don't know how to like advocate for themselves when they go to the doctor. All of that stuff.
Like super important to know because I didn't know that. I mean, usually when you talk about, like we had a conversation before the podcast about opioid sort of stuff, and you think about like illicit drugs and opioids being sold under the table in the black market, so to speak, or on the street. But you have to
albuterol inhalers, yes.
Which is something like at the hospital, like I can go forward right now from the Pyxis machine or whatever, and like, okay, here's the asthma inhaler for that albuterol inhaler. Well, that's so crazy. And I think that really has to do with how the social determinants do play out. Like our whole conversation has been like it's all interconnected, and it's about how do we give more education and also put this patient population into a better like place. Yeah, and it's super. I don't know the answer to that play because this is super complicated. But I mean, looking at the background, kind of like when patients go from the home, they go to the emergency department and come to the ICU or to the medical surgical floor, and they're getting treated for something that they never knew they had because no one ever educated them about it, and that's because they never had the resources to begin with to go seek a doctor. And now they're 30 years into this disease and they don't have any resources for that.
And we talked about it, I think, an episode or so ago, or whenever the last time we spoke about how folks access healthcare and access like urgent cares, and now bringing into the conversation of social determinants of health. Like if we look at, the obvious barrier of like South and North Stockton, being the Crosstown Freeway, like north of the Crosstown, there's over 20 clinics that are available to folks. But like south of the Crosstown, there's only 5 that I counted. I literally Googled this like before this podcast to really drive that check because and one of those is a methadone clinic and another one
to address substance use,
right, and which is all this very important, but like and then there's also a dental clinic, and so there's really only 3 like health clinics,
so there's not really like a lot of diversity in resources. It's kind of interesting.
So folks are more likely to go to an ER, to a T-light emergency room.
Because the South Side is heavily disinvested.
Yes.
And it shows through the buildings around us.
Yeah. And I think that Stockton's very multi diversified, sort of community. But the thing is, this is happening everywhere.
Yeah,
All of California,
exactly.
all of the, which is so sad. And I think like bringing it back to what we've experienced over the last few years with COVID, all of these sorts of social determinants really shown themselves. I mean, you think about our healthcare system, which is supposed to be top of the line in the entire world, and then we have a pandemic where you have many, many, many more people who don't have resources having to go to the emergency department and then having to get admitted, and then now hospitals are overflowing, and then that leads to nursing shortages, pharmacist shortages, physician shortages, everyone being burnt out, not enough resources to treat patients for basic things like diabetes, asthma, and all the other comorbidities that are affected by COVID. And it's this whole spiral. And it really has to do with all the social determinants. And there's no back there of it.
And then not even mentioning like the social and community context of, how that takes a huge hit when you have to go into isolation, when you're not around folks. And then, it's like more recently we're able to like be around like community and stuff like that, but there's still precautions that need to be taken, and like social distancing. And then also when you do get sick, you kind of go right back into isolation, and that definitely plays a part on health, I think, too.
Definitely. I mean, I've heard stories of people having to isolate, and then, that's one that's really hurtful to our, like, as humans, our social development. They tell them that, and also, like, economically, like, you're not able to go back to work for image in that period of time, and then also, like, the stigma portion of it, right? And so we got people who are infected or get sick, and then the rest of their family either somehow stigmatizes that as like, oh, you're just too high risk, or you are too reckless with your health, or on some other issues like that. Yeah. So there's those things out there. But then there's even the upper spectrum of things where people aren't really taking COVID that serious, and then you have that stigma of people who are either anti-vax or don't really know like information on the vaccine, listen to misinformation, and then stigmatize those who are like pro-vax or vice versa. There's so much
Careers politicization.
Yeah, that makes it really hard to navigate like even like social like conversation things. And I remember like when we first were able, like a lot of the isolation like guidelines were lifted and stuff, and like a lot of those the conversation we're having were still about this thing that's affecting all of us. We're just causing like stress to go all the way up. And I remember too, like, I don't know, like whenever one person got sick, and then it was like blaming who got me sick and like all of that kind of stuff.
Yeah, we're starting this.
It's because you didn't wear your mask that one day,
Or you went to this place.
or you're not like hygienic, or
Yeah.
I know all that stuff it's so sad, but it's all this pandemic really kind of shine a light. And because even from my perspective in healthcare, where I don't really deal socially with patients, but I do see it impacts their treatment, it impacts their discharge plan to leave the hospital, and it's just so interesting.
Yeah, you mentioned like the pandemic really showcased all the social determinants of health, and we covered like zip codes and like health inequity, and also racism like that. And really, even in the ER, I would see like just making a mental note of the people I've seen who have gone through like the disinvestment within healthcare are mainly like the BIPOC community. And it's really disheartening to see like the lives that have been lost through the pandemic. And a lot of them are from, the BIPOC community. And it just showed like how like in healthcare, there's a disinvestment in like that community, and like not enough education on like affordable coverage, or what are your benefits, what are your rights, like the comprehensive care that they should have, like the right for it. Like healthcare is a human right, and everyone should have access to it and have access to this like patient-centered care. But I think the pandemic really showcased that.
Yeah, I just want to take a second to honor what you're saying, because that's super important. Like, they're in it when we say that community, like that's our community. Literally, that is our community of folks who were like really like heavily impacted during this pandemic, and continue to, because it's not like while guidelines have been kind of lifted in certain areas, but like the impact is still there. Like there's still people who are unemployed. There's still people who, like are unsure what to do, or like still in a mental health state of mind, but still need like access to other services, and so the impact continues to go in that way too. And then we talked about last episode too about like asthma being one of those things that like creates, some long COVID symptoms,
Yeah.
and bringing it right back to like personal health, beyond like the social determinants, like all of that does have a direct connection to how you live your everyday life.
Yeah, no, I think one of the things that, in our population here, that kind of gets dismissed is like the long COVID symptoms. Because we don't have a lot of good data yet, because COVID is still, 2.5 to 3 years in the making. We don't have a lot of studies that directly determine long COVID, but at the same time, we know that we have this patient population that actually suffers from long COVID, but nobody is necessarily validating them for that. And I think that's the one thing I see from like the healthcare point of view is, we treat patients who actively have COVID, like they have symptoms, they can get treatments, they get vaccines, and all that sort of stuff. But for our patients who have those long-lasting effects, like you talked about with asthma, where it worsens, or if you have like headaches, or your taste and smell is deficient, or you have brain fog or other neurological disabilities that after COVID, those things, it takes a while for those to get validated, like especially because we don't have data on it, and a lot of the healthcare doesn't really look at them quite yet because we don't know. It's hard to help those patients get the right resources and treatment. I think that's one, due to the lack of resources for that population, and two, we don't know much about long COVID yet, but we still should be doing something.
Yeah, for sure. I hear a lot of the headaches a lot,
Yeah, and the brain fog.
Yeah. Those are like the two that I hear most often.
And that affects your quality of life. And then like sometimes you can't even go to work, and then therefore you experience financial insecurity and instability.
Right.
That ends up it's affecting all of your basically every aspect of your life. Yeah. And so how is LMR helping to advance health equity is our next point. And I would say, like, I've only been part of LMR like during the pandemic, and the ECHO team came about in response to the COVID pandemic. And from the time I've been here, we have improved healthcare access the quality of healthcare access by partnering with LHJs, which are local health jurisdictions and public health departments, and strengthening those relationships so that we can make health care accessible to our community that we serve. And we want to continue doing that beyond the pandemic, and when we reach like endemic levels, like we want to continue to invest in this community. And I just hope like our community is not afraid to seek help for themselves and to be that patient advocate for themselves.
Speaking about the effects of how LMR improves our communities, what are some upcoming, clinics? Do we know those dates yet or anything like that, where our listeners can go to, like maybe March and April or something?
Yeah, so we have one coming up in...
and if not, we can always put it in.
Yeah, we have like two in mind, and it's actually in coalition with our other partners, other CBOs within the community. And we also have one in May where it'll be showcasing our other programs, and there will be health screenings, like free health screenings for the community, and then education on like COVID treatments and vaccines and free food resources. So everything offered is free.
Yeah, I mean, you could like at least 3 or 4 of the 5 meet social determinants right there. That's really awesome.
Yeah.
In my short time with ECHO team at Little Manila, just kind of being a collaborator from the healthcare perspective, like definitely I talked to Kevin about this, about how our videos are impacting the community. I mean, you see at Little Manila, we get 300 views, and you think about that's one person who is educated on the topic and can bring that back to their families. So yeah, like an exponential growth. And I kind of want to highlight one of the videos on Trauma Sister Eggs talking about COVID-19 symptoms that like almost 1,000 views. And that's just because of your guys' work with Little Manila. And I mean, like, you know, showcasing what COVID is, how people can find resources, what they can do at home. Those sorts of things are super important to bringing together like social determinants and improving health.
Yeah, and I think it's really important to like reinforce community engagement through like continually educating one another and uplifting each other's stories.
Yeah. And I learn a lot from you guys all the time because I go directly into people's homes, to mostly talk about asthma, but, I find that there's always going to be questions about COVID. There's always other questions about other like health outcomes and like the impact of other like illnesses. And so like train the trainer kind of thing, being able to share the knowledge between us also helps us bring that accurate information to the community, and so
Also,
I think that that's really cool. We also have at the end of February, which if you aren't, if you're listening to this on a later date, I'm sure we'll have another one, but a tech and literacy like workshop where we're going to be showing folks how to navigate, things like their health insurance and other health resources from their phones. Because like we found like, one, like language barriers, but also age barriers, see digital device and so, yeah, I think that that's really awesome to even notice that there's a gap in that and being able to like immediately have some sort of solution. That's fancy to gather more information. What else do people need?
Yeah. What is your health priority?
going back to that tech thing, like I didn't really know that was a thing until I was helping some family friends and relatives try to refill their prescriptions at that online, like CVS now for mom exam. It's so difficult to like figure that out. So you think about that times millions of people who use the apps. Like that's crazy. That's like super important information.
Yeah, for me, it's like having to teach, just my parents and my grandparents, like, to schedule your vaccine appointment. It's like step by step. And sometimes it does take a long time because they've never had to do it in the past.
Right. And everything is really like digitized, like even menus. Just again, things like it's really becoming more and more part of our world every day, and like it's where we don't want to leave a whole group of people behind, and make sure that like that's the thing about equity, to make sure that everybody has access to these things that they're just I remember when the internet was really becoming a huge factor, and I remember my dad was the one who was like, well, what about the kids who don't have a computer? What about, and he was talking to like the teacher and the principal about stuff like that. And that was a great way for me to like realize, oh, like this is I didn't know it at the time, but this is an equitable way of thinking about, access to things. And so to bring that into today's world, like we all have phones, yes, but does everybody know how to use them? And all of the new apps.
Yeah.
It's constantly changing.
Yeah, for sure. I had to ask someone at CVS how to use my CVS app. That absolutely.
Yeah, I mean, like, there's so many things, like they see that, or either like using your Sutter Health app or Kaiser. What?
I had to ask like West Diagnostics, like, how do I access my lab work from 3 years ago? So I can compare it to my lab work this year, like to see like if my personal health has improved. Like
that's great.
If you have that another conversation feature,
just about like 10 about that.
Super important. But anyways, like we're kind of getting to the 30-minute mark. So I just wanted to open up to you guys about social determinants. We talked a lot today about asthma, and just with that sort of disease, there are so many social determinants that limit like the treatment and care and the progress and health of that patient. Like what is your last statement about social determinants that can help our audience? Like what should they think about? Like are they resources you have, or anything that they could think about to boost their stance on social determinants so their health is overall better?
You want to first? First, okay. It's hard to not be pessimistic about it, but I think one thing I'd love for the audience to do is to, look at community mapping projects in your area, to see where there's gaps, to see where there's shortages, whether it be food or clinics or access to like safe and clean places. But also, how can you support the places that are being provided to you? I think that that's a really cool way to start, just on a personal level, and also as a community level, like. You can support those places as well so that they get more attention, sharing their things on social media or sharing them with your family and your friends. So there's so many resources that are like that, are not highlighted and that people may not know exist. And so being able to share that with folks.
Yeah, and then piggybacking off of what you said, like stay engaged within your community, so that way you feel like you're not alone in this, and that like you can seek help to get access to food security, to get access to these free resources, and to get affordable care later. Yeah, you're not alone in the struggles that you go through within your community, and that basically like all social determinants of health affect your quality of life. So to just be aware of your surroundings and see how you can go about that and like improve your overall health.
Yeah, I think to piggyback off of what both of you said, from the healthcare perspective, one of the biggest barriers is education and also like seeking out resources. And so one thing that just came up to me as an example of one of my friends who had some sort of like disease and he didn't really know what to do or who to confide in. And he found a Facebook group on his disease where they can kind of talk about, okay, 6 months after this disease started, this is what I did and this is how I got better. So there are things like, there are groups on the social world that can help you. In addition, we talked about asthma and patients not being able to take their medications the right way or haven't taken it the right way for a long time. Don't be afraid to bring your medications to the pharmacist or pharmacy or your primary care practitioner. Okay? Hey, just give me like a quick rundown. I know I've been on this asthma medication for 10 years, but I just want to make sure that I'm doing it right. Like it's kind of a checkup, like oil check in your car or any sort of checkup. Like just like check in with yourself and kind of reflect, am I doing this correctly? Don't be afraid to ask another healthcare practitioner to like give you feedback so that you can be better and take care of your health even better.
And I think for us, like, it's also part of, I'm very excited about being able to continue to share resources with those and to shed light on those things. So like the responsibility isn't just on you, it's on all of us. It's a community effort and like, that social and community context being one of those things. And so I just want to applaud both of you for like, using your voice to share and express like all of the different resources and concerns, on behalf of folks who, may not know where to, share this information, but we're doing it on a broad level, hopefully. And so thank y'all for listening, truly, to make sure it's not falling on and like that. But, if it helps one person, that's exactly.
And you as well, Jesse, you're literally decreasing asthma within neighborhoods. So that's awesome.
Well, to wrap this episode up, we wanted to thank our listeners for tuning in. Thank you, Jess, for coming on again for another episode. Like we love having you because you bring such like an interesting perspective. So if you'd like to hear more, you already know our social medias, our contacts, all that stuff. But thanks for listening, and we'll see you in the next episode.
Yes, thank you. See you.